My name's Tony Kalesa, and I'm a PhD student in the Department of Biological Engineering here at MIT, and I work with another graduate student, Jared Kay, and Professor Paul Blaney, and I'm excited to tell you about a new drug discovery technology we're developing to combat antibiotic resistance. So antibiotics these days is kind of taken for granted, but actually it's one of the greatest medical advances that was made over the 20th century. And that's because in addition to curing things like an ear infection, it also enabled lots of other advances in other areas, such as cancer or organ transplants, where therapies leave patients in a state that's vulnerable to infection. And so if we take together, antibiotics are actually written, we have 266 million antibiotic prescriptions which are written every year in the United States. And over half of all hospital patients in the United States receive antibiotics over the course of their stay. But we soon will be living in a world where we can't take antibiotics for granted. And that's because we're seeing resistance to all of the antibiotics in our current arsenal. In fact, we've observed resistance to every single one of the antibiotics which are currently used clinically. And together, right now in the United States, a study by the CDC showed that 23,000 deaths, 2 million drug-resistant infections, and $20 to $35 billion in direct healthcare costs are caused by this issue. And this is a problem that's incredibly nonlinear because as patients have drug-resistant infections, they're sick for longer and there's opportunities for those infections to spread to other patients. And besides running out of the current antibiotics we have, we're also failing to discover new ones. So like I said earlier, antibiotics were first discovered and deployed in the clinic in the 1930s and 40s. But if we look at all of our current antibiotics, the most novel one for a certain class of infections was discovered in the 1960s, and for another class of infections, the most recently discovered one was discovered in the 1980s. Some people have proposed that instead of discovering new antibiotics, we could also use combinations of drugs to combat bacterial infections. And the standard paradigm here is to combine drugs to overcome resistance. So this is the most common mode that we see in antibiotics drug development. But we think that there are also opportunities where you could have two drugs which work better together than by themselves, and they might have orthogonal toxicity profiles, and therefore you could use them together to cure an infection with reduced toxicity to the patient. The issue here with discovering combinations of drugs is you have this incredible explosion of the number of tests you have to run. So if you say, for example, there are 2,000 drugs that are currently approved by the FDA, and if we wanted to test all pairs of these drugs, say against a bacterial infection, and we wanted to run each at 4 different concentrations to check for dosing, this would cause 32 million tests that we have to run, and that would be across a single pathogen, when often we don't know what pathogen a patient is infected with when they come into the clinic. So we need to look at being robust to lots of different organisms, and each of these organisms also has different resistance mechanisms. Currently, the drug screening is done with these robotic facilities, which I took a picture of here. And you can see that there's a giant robot arm, which is about the size of me, handling the stacks of plates that are about the size of me, screening millions of these tests, which I described. And we want to replace this with something that's handheld and can be done much more easily at a lower cost at the same throughput, basically giving you the power of these high throughput screening facilities, but in a much smaller format that you can do like right on the bench top. Our platform works by taking these drugs and emulsifying them into tiny water droplets. And these droplets are so small that it's easy to handle millions of them at a time. And the way we're going to construct combinations to test is by taking each of our drugs, putting them in these droplets, and creating a mixture of these droplets, which we then load into a microwell array. Here, the microwell captures precisely 2 droplets, and since we have a pool of these droplets, each carrying different drugs, we can randomly scatter the droplets across the microwell array to automatically construct all of the combinations randomly. This is what this looks like, and here we can actually decode what each pair of droplets in each of the microwells you can see here is carrying by color codes. So you can see all the different droplets are different colors that encodes the drug they're carrying. And then we can merge the droplets to construct the combinations and expose this to bacteria to see how they respond. And so you can see in the top right here, I'm showing a pair of drugs encoded by this blue and magenta color, where it completely obliterated the growth of the bacteria, but in the bottom right, you have a pair of drugs which caused no effect. So please come to our poster for more information or come to our table during lunch. Right now with our prototypes, we're able to screen tens of thousands of combinations at 10% the cost that it's done conventionally, and we can do all this by hand on the benchtop. And we think with further automation, we can actually make another tenfold leap in improvements. And we're also expanding our platform to new areas such as cancer. With that, I'd like to thank the Sponde Center team, especially our catalysts, Lori Pressman and Christine Bunt. Thank you.